Hi, and welcome to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation focused on youth mental health. Before we begin today's episode, I just wanted to let you all know that all content that is found in our podcast is created for informational purposes only. This content is not intended to be a substitute for professional medical advice, diagnosis, treatment, or therapy. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something you have heard in this podcast. Thank you so much, and without further ado, let's get started.
Hello, everyone, and welcome back. Think about the last time you had a huge decision to make, or the 10 minutes right before a finals test, or even a big performance. Did you feel it in your head, or also in your gut? Do you remember the butterflies in your stomach, or the feeling of your stomach dropping? Well, right now, I feel butterflies in my stomach because we have the huge honor to have the esteemed Dr. Kara Margolis joining us today. She's the professor of molecular pathobiology, pediatrics, and cell biology at New York State University and the director of the NYU Pain Research Center. Her work lies in making our lives better by discovering how we can identify and treat disorders faster using smarter gut signaling via the brain and GI tract. Today, we're going to deep dive into this and learn about the science behind our gut and our brain, their connection, and what we can do to strengthen them. We're going to explore what we feel we're going to explore what we feel in our gut and how we can use this knowledge as high schoolers to better our everyday lives. We have the one and only Dr. Karen Margolis joining us today. Welcome.
Thank you. Thanks for having me.
So I want to start off by asking you, what led you to research in this field, and what discoveries have surprised you?
So, what led me here? So, as I'm a pediatric gastroenterologist, and in my practice, I was seeing tons of kids that were coming in with stomach pain. And when I was seeing them, I saw that the overwhelming majority of them also had anxiety or depression. And I became very interested in the link as to why mood would occur so frequently with abdominal pain. So that's what got me really interested in it, is that I saw these two conditions occurring together and really not a lot of research being done into what those links were. I think the most surprising thing is the idea, as everybody's recognizing now, is that the gut is a huge communicator with the rest of the body. There's all this research into the gut microbiome, but there's so many different pathways by which the gut talks not only to the brain, but to many other parts of the body. So what became, I think, the most surprising to me through this is really that the gut is almost like the mayor of the body. I feel like it talks to many different organs, organs talk back to it. And so it's so critical, not only for gut health, but also I think for whole body health.
That's interesting, calling the gut like the mayor instead of the brain, what we normally think, which is maybe why we call our gut the second brain.
Yes, my old mentor is the one who coined the enteric nervous system, the second brain.
That's awesome. So let's dive right into this. What is the gut-brain axis and why is it important?
Sure. So the gut-brain axis is the communication that goes on between the gut and the brain. It happens 24 hours a day, 7 days a week, and it's bidirectional. So that means not only does the brain talk to the gut continuously, but the gut talks to the brain at least as much. And what was your second question? I forgot.
Why is it important?
I think it's even though the brain can act independently from the gut, and the gut can actually act independently from the brain in some of its actions, that the communication between them is so critical in helping to keep both systems healthy. So, in other words, if your brain is stressed or depressed, it sends messages to make your gut not feel well also. It's like what you've said, if you have a big presentation to give or you're going to give a big dance recital, not only do you feel that anxiety in your brain, but your gut feels anxiety, and that can come out as pain or as nausea. And similarly, if your gut is not doing well, say you have an infection or an inflammatory condition, patients with those kinds of conditions have much higher rates of anxiety and depression.
Oh, that's eye-opening. So, how does our gut and mind talk to each other? Are there like chemicals or hormones that are produced that send messages, or how does it work?
Sure, so I think it's a great question because I think just emphasizing how important that gut-brain communication is by the many different ways the body has to communicate, or the gut and the brain have ways to communicate. So, like you said, one of the ways is by hormones. So the gut nervous system, the nervous system in the gut, the second brain can give off different hormones or mediators that can go through the blood and get to the brain. Then there's direct highways of communication. So the vagus nerve is a direct highway. And so, what we found and what others have found too is that not only can the gut microbiome, but gut serotonin and many other neurotransmitters can then actually activate receptors on the vagus nerve to actually communicate messages that control things like mood and appetite. And then you have your spinal cord, which is also one of those highways. And that's really a major way that the gut can communicate with the brain to send off messages of pain. So when you have stomach pain, it generally goes through that spinal cord. And when there's things that, make you feel nauseous, say you eat too much or a big meal, it's usually that vagus nerve that is that communication that makes your brain aware to stop eating because you don't feel well.
Got it, yeah. So it's not just stress hormones or hormones that are being produced, but it's also like the vagus nerve and the spinal cord that act as the highway. And then sometimes you mentioned that receptors can turn on and they send the messages to the brain.
At the receptors, right? These receptors can be on the vagus nerve or the spinal nerve. And you may get into it a little bit later, but obviously the gut microbiome is a big part of that. There's trillions of microorganisms that live in our gut, and they can send direct messages through the vagus or the spinal cord. They can make the gut secrete different hormones that then can communicate through the blood. So there's this also very important communication between the gut itself and the gut microbiome.
Yeah, the gut microbiome is fascinating, and we'll definitely touch into that later. And now, one other thing that's important in our gut, obviously, is like the food that we eat. So usually we think that the only thing we consume is food and nutrition, but we consciously or unconsciously also consume like news and social media. So how does what we consume, both nutrition and social media, impact our gut and our brain and how they communicate?
Sure. Those are really important questions. Certainly, there's a lot of scientific data showing that there are things that are good for your stomach and there are things that are not so great and that can have been shown to have connections to brain health. So for example, a plant-based diet with fiber that produces anti-inflammatory and mediators like short chain fatty acids that increase your energy in the gut. And so through mechanisms like that and in other different ways, eating a high fiber plant-based diet has actually been shown to potentially be better for your mood and to help be a treatment for anxiety and depression. Similarly, ultra processed foods have been shown to potentially be inflammatory, to cause the gut to become a little bit leakier and cause things that may actually increase anxiety or depression. Food is always going to the gut first. And so that's going to be more of a gut to brain connection. Social media has been really hard, I think, on adults, young adults, and kids. There's many a time when I'll see a child in my practice who is very anxious because they didn't get invited to a party that showed up all over social media, or somebody's talking about them on social media. And those kinds of things are more of an anxiety that you may feel through your brain, but obviously, because that brain then communicates to your gut, these kids come in with things like chronic abdominal pain.
Wow, yeah, I would have never thought that having anxiety and then something that starts in the brain would actually lead to some pain in the gut. And I think that's eye-opening. And then you also mentioned like the impact of food and that the food the food definitely changes the way your gut is acting and what your gut's absorbing, which is then gonna impact the rest of your stomach. And that I think is a big thing. And you mentioned high fiber diets are really good. And I actually find it really cool how you can change your diet and then change and reduce anxiety and depression. So that's really cool. And then another question I have, and I feel like the audience might be thinking about this too, is that, for example, I ate something that gave me food poisoning. So in this case, I'm assuming that my stomach is hurting just because of what I ate. So then how can we differentiate when my stomach ache relates to a mental state versus when it's just something I ate that my stomach isn't used to?
Sure. That's a great question because, as I said earlier, that gut-brain communication happens in both directions. And it's sometimes a challenge when people come in and they have both of these conditions, because you have to figure out what came first, how to treat it, or how to treat both simultaneously. And that's been a hard thing in the medical fields. I think, what I see when I have kids come in and they have anxiety or depression and they also have gastrointestinal issues is that I try to treat both simultaneously. So, what's interesting is that a couple of things. One is that some of the medicines that we traditionally think of that might treat anxiety or depression, so what are called SSRIs like Prozac, while they're used to treat the brain, the same receptors are actually in the gut. So it can impact the gut too. So a lot of times those are used for, say, for treating patients who have GI problems, but also have mood disorders at the same time. And similarly, when you have cognitive behavioral therapy, which is a type of therapy that you can do with a psychologist or a therapist to treat anxiety, that's actually been shown to make your gut better and may actually even alter your gut microbiome. So I think, when patients come in with both, or when people are experiencing both, you really have to look at both together. And sometimes, if someone's had a 3-year history of anxiety and then developed a gut problem, I may try to treat the anxiety or work with a psychologist or psychiatrist to treat that anxiety first. Similarly, if someone had a gut infection and then they get a chronic irritation from that and have anxiety or depression as a result, I may start targeting the gut first. But oftentimes it's not that clear cut. And patients come in with both. And then the best approach is really the holistic approach and to try to get everything under control at the same time.
Yeah, I see. So you mentioned that usually both problems come hand in hand, and then you try to fix them together or work on them together. And I think it's really cool actually how you mentioned that CBT, like cognitive behavioral therapy, actually fixes your gut too. Like I would have never thought that part relates, but that's really cool. And I really like the fact that you said that you use a holistic approach. So instead of just trying to fix the gut and the mental state separately, you work on them together. That number one also, I would assume, speeds up the process, but it also focuses on like the underlying issue rather than taking these two things separately.
Yeah, what I would also say is that when you think about a holistic approach, excuse me, that it's not only about directly treating the gut or directly treating the brain. There's a lot of things that we recommend in that holistic approach, like exercise causes the release of happy hormones or endorphins like serotonin that really can help your mood and then can help also your gut move. A good sleep hygiene has been shown to improve both things. A walk through nature, like for 10 or 20 minutes a day, has been shown to improve gut brain health. So there are things too that you can do that are everyday I call them simple life hacks that may help, but wouldn't actually occur to you when you're thinking about when you're suffering from abdominal pain or anxiety.
Yeah, wow. So you said that like even when you do therapy and that increases like the happy hormones in you that actually then like we've talked about goes through like the highways of this vagus nerve and the spinal cord and they talk with your gut too. That's really cool. And thank you so much, Dr. Margolis, for the insightful information. I had a wonderful time, and I learned that even therapy that we think is just for the brain, like CBT, can actually impact and help our gut. So, to our audience, I hope you learned something too, and be sure to be on the lookout for our next podcast with Dr. Margolis.
Thank you.
You are listening to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation. As part of our youth series, we will be releasing new episodes every month, so make sure to continue to check those out. We hope you enjoyed this podcast, and we thank you so much for listening.